I'm with Jana Berghoff, who is the Corporate Technology Marketing Manager for Patterson Dental. Patterson Dental has recently introduced CAESY Cloud, a new product that I want to talk about in just a second. But good morning to you, Jana, and I wanted to open up by asking you why it's important for dental professionals to use available technology as part of the patient education segment of an appointment.
Well, technology, I think, sets the whole stage for the dentist and the patient's attitude towards the dentist. If a patient sees that a dentist has a lot of technology in the office, it gives the impression that the doctor's staying in tune with current trends. And anyone that's providing health care for someone, that person wants to know that they're staying in touch with what's available and what's new in the treatment arena, as well as in general, just staying in touch with everything. So I think a dentist that has technology imparts to the patient that they're staying in tune with what's available to them.
What about the patient education, though? They used to be have the toothbrush and the model in one hand, and that was the way patient education was conducted. So, how does technology take it to the next step?
Back when I was a hygienist, that's how I did all my patient ed too. The great big red teeth with that huge, toothbrush showing everybody how to brush the teeth. And so I can speak personally saying that the education on how to brush your teeth with my first patient during the day varied greatly for me to the time I did it for my last patient in the day. Saying and teaching this 8 times a day, 5 days a week for however many years, I started losing the passion for it just a little bit. And I think with technology playing a video, what that can do is it's a consistent message over and over again. And you don't forget parts and pieces along the way. So if I was instructing on how to, talking about a crown, let's say, if I've done this a number of times, I might forget valuable parts of teaching that patient about the crown they're going to get. But if I'm playing a video or animation, when the doctor walks in to talk to the patient, they know exactly what that patient has heard. So it's consistent. And I think that's the important part.
Okay.
There's also time savings, but the important part is the consistency.
Well, let's talk about the CAESY Cloud for a second. I want to quote from a statement about the product by Patterson Dental. Their statement said, dental professionals will have access to valuable patient education resources from multiple locations at the same time. Can you explain what that means?
Yes, one of the ways that we delivered our CAESY educational material before was in DVD format. And so whenever they wanted to play a video, they needed that DVD in the room. So unless the doctor bought multiple DVDs, they would only be able to, whoever had the DVD would be the only one that could play the video. So now with CAESY Cloud, as long as all the computers have the internet, they can just jump up into the clouds and pull whatever video they wanted. So multiple computers within the same office can be playing the same video at the same time without having to be dependent on finding wherever that DVD is.
I get the impression that CAESY Cloud is allowing dental offices to be more versatile with the amount of information that's available to them. Is that an accurate perception?
That's a very accurate perception because, well, and from two sides, within the office, they don't have to bring the patient to a certain location to show the video. If they have an iPad in the office, they can take that iPad to wherever the patient is sitting. So they could work with them, show the patient a video in the reception area, in a treatment area, in a consult room, any place within the office. They have the flexibility with the mobile devices to show the video. For us, the flexibility is right now with just the DVD format or even with our enterprise format, we have releases once a year where we announce or let out our new videos that we record. So if I recorded a new video today, it would just sit with Patterson until I had a new product release for the DVD or the enterprise. Now, as soon as I have a new video, I can put it on in the clouds, and that new video on new dental content is available immediately. So I can stay more, and we can stay in the delivery to the office more contemporary or more up to date with what's available in terms of our videos.
For users to use the product, there is a subscription fee involved. I take it, sort of a membership fee, is that correct? They have to have internet access? Is that how it works?
That's exactly how it works. There's an enrollment fee, and it's per location or per office. So if a doctor has multiple locations in different cities, he would have to sign up individually for each of those offices. So there's an enrollment fee of $295, and then based on the number of active connections they want, if the doctor says, I will never have more than 5 computers showing a CAESY video at one time, then they can sign up for the 0 to 5 connection package, which is $59 a month.